Okay, good afternoon, everybody, and it may not be afternoon where you are at this point, but greetings. My name is Dr. C. Clifford Smith III, and I'm a life coach. I'm a senior pastor. I'm a Bahamian intellectual, and the purpose of this video is to join my voice with the voice of so many of our leaders that are making our best effort and attempt at managing our country and our human resource through this COVID-19 passage. I want to, at the outset, very quickly state that I hold in high regard not only the leaders of our country, but also our healthcare professionals because they are trained and they are scientists in their discipline, um, trained in ways to deal traditionally with their approaches to not only health maintenance but remediation of disease whenever there is a problem. Um, I want to say what I'm going to say in three areas. One has to do with knowledge. The other has to do with dealing with fear, and the third has to do with personal responsibility. Let's begin with knowledge. What we know about COVID 19 is that it is 98% survivable, but the disease itself is highly contagious. And therefore, there are certain things that we, need to do if we're going to survive through it. We do know that COVID 19 currently, there's no cure that has been publicized for it yet. There are no readily available vaccines. And so, what we have been attempting to do through social distancing and the like, and these national and city lockdowns, is to control the possibility, I suppose, of the spread of the disease by keeping people apart and out of a lot of public mixing as much as possible. Um, in the knowledge arena, I always say that, there are always things that we don't know that we don't know. And one of the things that I think we don't know that we don't know is that we tend to approach most crises the same way or based only on our traditional thinking because our whole education system has really conditioned us to think conventionally about the way that we approach managing a disease, managing crises. So, that said, I want to uplift that as a paradigm that can sometimes hurt us more than help. What am I saying? I'm saying that as far as knowledge is concerned, we know that the disease is contagious. We know that it is just highly contagious. It's easy to spread. We know that there are thousands of people that have already lost their lives. But what we, I think, what we're missing in our examination of the way the disease runs and what happens with the public is that all of the city shutdowns and national lockdowns, once people get back together, the disease starts spreading again, which means that perhaps while the lockdowns are going on, it becomes necessary for us to re-educate ourselves about, how we're going to deal with the disease. Now, I feel strongly that the number one thing that we need to look at is one, how can we prevent the lockdowns? Well, lockdowns keep people apart, but lockdowns also cripple an economy. Lockdowns stop commerce, lockdowns stop exports, lockdowns stop imports. And so all this going on is the country at the level of productivity economically becomes stagnant and is suffering while we are waiting remedial action. Um, it therefore becomes necessary, in my opinion, for us to look at some other avenues in terms of, making certain observations that may help our people. For example, there are any number of citizens in countries that continue to survive between lockdowns and have not yet been contracted with the disease, even though they themselves go in and out amongst the public. This brings me to something that I think we need to be looking at in terms of educating our people about how to take care of yourself so that you become less susceptible to the disease. And this is a very strong point in this whole area of knowledge that I'm talking about. Um, it has been said that people who have lifestyle diseases, comorbidities, persons whose health condition is compromised, people whose resistance is down, that these individuals are persons that will be most susceptible to catching coronavirus. So let's deal first with immunity. Let's talk about resistance, because the best way for you to build and maintain good resistance is through simple stuff. Number one, like vitamin C. Vitamin C, 1,000, anywhere from 1,000 milligrams to 3,000 milligrams per day. And you can take the hard tablets, is what I recommend the most. Um, that's number one. Number two, pine bark. Pine bark is the type of plant-based extract, and it's already you can go up and look it up online. It helps the body to boost in terms of your resistance levels, and so your immunity is up. That coupled with vitamin C gives you more than just a fighting chance to ward off the disease. Zinc. Number three, zinc helps the body's cells to strengthen in such a way that if you ever come into contact with the coronavirus, with a coronavirus, because the coronaviruses are common, but this COVID-19 is just perhaps the most infectious that we've seen in recent times. Zinc helps the body to strengthen its own cells, enabling the cells to prevent themselves being penetrated by the virus. That's very important. So all of these that I'm talking about in the knowledge dimension have to do with looking at plant-based and mineral-based uh, uh, um, um, supplements and approaches to building immunity. If your resistance is up, you will be less susceptible to the disease. Now, why am I talking resistance? Why is this a crucial point? If the health of the herd based on immunity is at a higher level of resistance, then the disease will be in and amongst us, but the disease will not overrun us because most of us in the herd are stronger. In the meantime, you will have asymptomatics who can develop antibodies. And as the herd continues to develop antibodies, the populace, I'm saying herd science is, how scientists refer to it. If the health and the ability of the populace to ward off the disease is strong, then we can open the country, we can open our shops, we can open our churches, we can open our businesses, right? We can open our borders because our people will be strong enough to handle the disease. Let me give you an example of where this works, and we do it every cold season. Every cold and flu season, people get the flu shot. In some cases, the flu shot is nothing more than a hypervitamin C injection. And what it does is there are thousands and thousands on top of thousands of people that make it through the flu season that had they not had that shot, they would have been so susceptible that they would have died with the other thousands that flu kills annually. And so I'm using that as an example to say, build the immunity of the populace. Building that immunity makes us less susceptible to the disease until a cure, an actual cure for the disease can be found. Um, that's what I call the preventative side. Now let's talk a little bit about the curative side, and here's where we must be able, and I'm talking knowledge now, we must be able to add conventional medicine to traditional medicine, or conventional medicine to natural medicine. Now, uh, the most natural mix of substances that I've heard over and over and over repeatedly. And as a leader, I like to pick up and read things and then study and listen, and then repeat what I've heard. Um, uh, Hydroxychloroquine that's been used to treat malaria, lupus, and patients with rheumatoid arthritis seems to have a serious effect on the coronavirus when used in conjunction with zinc. I'll say that again. Hydroxychloroquine in conjunction with zinc, what it does is it slows the ability of the disease to attach to organs, and to cells in the body. And zinc strengthens the cell so that the cell wards off the coronavirus. After a while, between the two, very quickly, what it does is it effectively causes the body to develop antibodies, the human body, and then it causes the person to outlast the disease. If you get it, that's for if you get it. You shouldn't be taking hydroxychloroquine if you don't have the coronavirus. If you've been treated, if you've been tested and you've tested positive, I strongly recommend that you ask your doctor about hydroxychloroquine, and working in conjunction with zinc. The third component is if you get an infection, the doctors are saying take an antibiotic. Okay, here's a plant based antibiotic. It's called golden seal. It comes from the root of a plant. And when you use golden seal in conjunction with echinacea, which is it's a one of these natural plant-based extracts that helps to open the airways and the pathways. It's been used a lot for asthma patients. If you use those in conjunction, and there is an echinacea golden seal uh, uh, remedial mix that you can actually purchase. You can get it from any, you know, serious health food store. You can get it from there. You can get zinc, you can get vitamin C, and you can get hydroxychloroquine through your doctor. If you use these in conjunction, just in case you do get the disease, you would use the hydroxychloroquine, but use it as your doctor prescribes. A 5-day treatment of hydroxychloroquine uh, really involves 2 tablets, one Monday, probably one Thursday. This is what the doctors tell me. I am not a physician, I'm not a healthcare professional. I'm just another intellectual who knows that if you find the right information, you try as much as possible to get it to your people. I'm not here to prescribe anything for anyone. I'm just here to give information. I come out of a discipline because I'm a life coach. I'm a Christian life coach. And my main manual tells me that people perish for a lack of knowledge. So when you give people knowledge, then people ought to be able to make sensible and wise decisions about themselves. And so I wanted to say that in the knowledge dimension, because if you have these mixed together, uh, number one, you can ward off the disease if you're using the right minerals and vitamin C and all of that, as I spoke about earlier. Number two, if you get corona, you can add in the hydroxychloroquine along with the zinc. And if you get an infection, you add some kind of antibiotic. The doctor might not like golden seal. The doctor might prescribe something. They have all kinds of things that they prescribe, and you work those. Um, in all of the cases that I have been exposed to, I have been told, and I've seen these people who got up in 5 days. I mean, 5 days, the treatment, 5 days, a 5-day treatment, and they were cured. All right. I'm saying that because now, why am I talking like this? Here's the why behind the knowledge, the little knowledge lecture that I gave just now. We're a touristic country. Most of our GDP comes from tourism. So if you cut that off, people are not coming. We are so close to the United States of America that if people can come, They will come. They'll land here tomorrow. They'll be in the Bahamas next week, as early as that. It doesn't matter because people want to travel and everybody loves the Bahamas. Location, location, location. So my thing is this: if we strengthen our populace, who for the most part provide transportation, culinary, accommodation, types of services, they provide spa and health services for our guests. They provide social and recreational opportunities for our guests. They work amongst our guests. So the thing is, if we strengthen the herd, if we strengthen the populace and put everybody back in place, let let visitors come, whether people come with or without coronavirus. Right now, there are enough rules that prevent people from just traveling without having tested first anyway. So to the degree to which you might get people slipping through the cracks, at least your populace will be strong enough to handle the coronavirus. Now, let me go to a second dimension. I talked about knowledge, I talked about fear, and I talked about personal responsibility. Let me deal with the personal responsibility before I deal with fear, because I want to deal with that last. Um, Personal responsibility, once you have the right knowledge, is for every single citizen, every individual to remember our managing and fighting against coronavirus and the wearing of masks and personal hygiene practices that are acute given our circumstances is not a matter of personal or political opinion. Let me clear that up. It's amazing how in every nation people have politicized the approaches that have been advanced to dealing with coronavirus. It's between this party and that party, this group and that group. Now, folks, coronavirus doesn't matter which party we are of, doesn't matter which leader we like, the one in or the one out. It doesn't matter. The coronavirus does not care. If we changed our president tomorrow, or if we changed our prime minister tonight, or whoever's head of state, coronavirus will be right here in the morning waiting for that person to come up with some plan again to try to fight it. And there will be another set of people who will be saying, well, just because it's them talking, I'm not listening. Folks, let me talk about personal responsibility. Everywhere I go, especially because of the work that I do, I have to deal with people. So on a regular basis, I have this practice. I wear my mask over my mouth and my nose. I'll say it again. I've seen people in our society who wear their mask, but they're wearing it. They've got their mouth covered, but their nose is out. You you are not covered. You're uncovered, and you're going to catch something because your nose is an entryway to your air passage. And so you have to cover your nose and your mouth. And I believe that the authorities, to the degree to which that we can tell people, look, if you are seen in the public or one of our inspectors or police officers takes a photograph of you with their cell phone, as far as we're concerned, and you are wearing your mask under your chin or it's over your mouth, but your nose is uncovered and you are out in the public, you will be liable to a fee. You'll be liable to a fine because you are participating in this unnecessary spread of the disease. You're participating in the possibility of catching something, catching it, and taking it home to mama. So I think personal responsibility must take precedence over our political and personal opinions. It's not what you think and what I think. It's not whether we like this prime minister or we don't. It is about the fact that coronavirus is here. So you should wear your mask over your mouth and your nose everywhere you go. I do it. I do it. And when I get back to my car, if I go into somewhere, when I come back out, I carry sanitizer in my car and I carry wipes in my car. So when I come back out, the first thing I do before I take my mask from behind my ears and take it off my face, I sanitize my hands. And then I take wipes and I wipe off my steering wheel. Do you see what I'm saying? And then I wipe my hands and then I take that particular wipe and put it in a bag in my car. Then, secondly, I remove my mask because my hands that touch my mask are going to be hands that are sanitized already. I put the mask down, and that mask is going to wash every week. It's going to wash. It's going to wash because, especially if I've been around people who had their mask off and they were just talking, and I had to back away or move away. You know, people are irresponsible, and we must take personal responsibility. But that mask is going to wash. And then when I'm done, I'm going to take out another wipe, and I'm going to wipe my whole face and everything, all right, before I start my car to move. If we can all take personal responsibility, and remember, when you leave your office, you leave your car, you leave the safety, all right, the safety and the cleanliness of your own home, and you're entering the public domain, have enough respect for the public. If we can all remember to have enough respect for the public that we want for ourselves, I think we would slow the spread because of responsibility. I do not need to overemphasize that point. It is very important. The last thing that I wanted to talk about was fear. Let me tell you what fear is, okay? Fear is fear is when you are living in an unknown. And I give as much credit as can be given to our leaders. They're doing the best that they can, but we're living with an unknown. Nobody has yet come up with anything to cure or just completely eradicate coronavirus. So our leaders, to a certain extent, have certain, fears about what could happen to their people, and that must be respected. But the flip side of fear is that sometimes we have to take another look at trying to beat fear by using some approaches that we're not traditionally, exposed to, or should I say, that we're not predisposed to. Let me put it that way. And that's why earlier I talked about the eclectic approach of using not only conventional but natural medicinal remedies. And you can go back to that part of the video if you need to make reference to that again. But we must deal with the fear. Fear, secondly, is not only fear of the unknown, but fear of what we're hearing every day. One of my favorite stories in the Bible, I don't want this to sound like I'm, giving a Bible lesson, but it's a little, just something that I think you would find freeing in your mind. There's a story about David and Goliath. Everybody knows that story. There's a very interesting part of that story that talks about and describes how every day Goliath came out there taunting them. Every morning he came out talking to them. Fear is the news and the numbers and the uncertainty and the death toll and the board that we're seeing with the virus every day. When it's in the front of you every day, you're scared. And that's why workers are seeing all these people, our healthcare workers, our frontline workers, they're afraid. They're afraid of what could happen to them, what could happen to their children, what could happen. Well, I really need to say that, fear can be overcome. Yes, it can be overcome with faith, but it can be also overcome with the application of knowledge and critical thinking. If we think critically and we try to take personal responsibility, see that? And we add in the knowledge that we need that may come from unexpected sources and advice, I believe we will be able to beat fear. Fear will cripple you. It will cause you to make the wrong decisions. It will cause you to act in haste and do things on the fly, and you're not really making any sense. And so, as one leader, as somebody who just has a concern about our country, I wanted to share this with you, and I wanted to put this out there. I think if our population is stronger, at least until something is done, if our population is strong enough, we would be able to avoid catching corona. If our population is responsible enough, every single one of us, then we would put our country and our society in a position where we're respecting each other and we're avoiding, I'm going to wear my mask because I respect you, and I think you should wear yours because you respect me, and we want each other to survive. personal responsibility is going to cause us to win. And finally, we must overcome the fear factor. Folks, this was what I wanted to say. I hope that this gets to the right people. I hope that you hear me as a senior pastor, as a life coach, and I hope that you take another look at our society, because if we continue the lockdown, we are going to very, very effectively cripple our country completely, and there will be irreparable damage. I'm not a conspiracy theorist, but I'd like to believe that there are those who would like to take advantage of this whole pandemic and try to bring small nation societies to their knees economically, and then come out with some other ulterior motives when they come offering help. That's all I'm going to say right there. But I do want you and I to live and to be able to survive, not only nationally, but personally for another day. And so thank you for listening. Thank you for taking the time. Thank you. And may God give us wisdom and resolve. You take care. Be safe.